Currently, the medical world is facing the biggest medico-legal issue in the history of modern medicine in the pelvic floor area. Since the first medico-legal case involved vaginal mesh implant, which in July 2012, the month Gangnam Style was released, today in America alone, there are about 100,000 similar court cases involving billions of dollars in compensation. It is very important, before any treatment is prescribed, to first have a holistic understanding of pelvic floor and constipation-related disorders. A healthy pelvic floor is important for normal functioning of pelvic organs. However, sometimes pelvic floor gets damaged due to birth trauma, chronic straining during defecation, and even muscle wasting due to aging. Pelvic floor damage can manifest in various ways, such as urinary incontinence, urinary leakage with cough or sneeze, frequent recurrence of urinary tract infection, sexual dysfunction, constipation, uterus prolapse, hemorrhoid, which is actually anal mucosa prolapse, fecal incontinence, prolapse of rectum. Chronic straining during defecation gradually damages the pelvic floor. With the pelvic floor damaged, constipation gradually worsens. Constipation is both the cause and manifestation of pelvic floor damage. Together with pelvic floor damage, constipation and straining form a vicious cycle. Constipation due to whatever reason will lead to straining for defecation. Straining would damage and cause pelvic floor to descend, which in turn would worsen the constipation problem in the form of obstructed defecation. Majority of constipation are due to pelvic floor sagging. If not corrected, the defecation process gradually damages natural pelvic floor support to contribute to various pelvic floor disorders. Bowel Aid is the latest medical breakthrough. By just providing supplementary pelvic floor support during defecation, it facilitates defecation to prevent problems arising from difficult defecation and protects the pelvic floor to prevent various disorders resulting from damages of pelvic floor support. For those who have undergone pelvic floor reconstruction, the reconstructed site will be put on extra tension during defecation. If uncorrected, it will ultimately lead to failure of the surgery or complications like what is experienced by tens of thousands of women worldwide. With Bowel Aid, pelvic floor descent and loading on surgical site will be minimized. If the load can be kept within physiological limit, the patient is likely to benefit from the mesh surgery without side effect. July 2012 was the month when the first patient with mesh complication was compensated, and also the month Gangnam Style was released. The popularity of Gangnam Style had reached a peak and started to decrease, where rise mesh complication is still continuing to increase. With Bowel Aid to ease defecation and protect pelvic floor, mesh surgery will continue to serve millions of women with urinary incontinence. Be appreciated lifelong, like the evergreen moonwalk of Michael Jackson.